I'm here in my role because I believe that for people to have healthy lives and have access to what they need to be healthy and well, they need to be supported by communities that have strong local health departments. And a piece of that is making it so that those local health departments can work together to get things done. I've been involved with NACCHO as part of the Council of SACHOs. Since its inception, I was one of the SACHO directors at the time that the council was formed, although I won't take credit for its formation. There were people who had laid that groundwork before me. But my primary involvement with NACCHO has been through the Council of SACHOs, which has been, for me personally, a very important piece of my professional growth. And I think also the Council of SACHOs has been able to do a lot with NACCHO and for NACCHO, and I'm very proud to be part of that work. Thinking about what NACCHO could do for local public health 30 and 40 years into the future, it's kind of daunting because there's really a lot of work. I would love to see NACCHO continue to strengthen and be able to do more, particularly in the advocacy realm. I would love to see NACCHO to continue to help build the public health infrastructure through its advocacy work, both I guess the big A advocacy in terms of, on Capitol Hill, but also all of the work they do in terms of communicating public health, local public health interests and concerns and opportunities to CDC and being a voice in some of those conversations at that level. I want NACCHO to continue to be here as long as local public health departments are here, and I foresee that we're going to need local public health departments until the end of time, so 30 years and beyond. I started in my position. I was the second director of NALID. NALID formed in 2010, so we're a relatively new SACHO. We started in my attic on my cell phone and my home computer. We as a SACHO initially were not as involved in advocacy work, but we're very involved in programmatic support, and we're able to secure some large grants, and with that leverage those grants to grow our infrastructure as a SACHO. And so now we are a team of 6 and an office, and our budget has grown significantly since those early days. We really work with our health departments to help them. We work in a lot of different ways to help them with workforce development. We're involved in community health worker advancement in our state in a number of ways. We have our own federal grant. We are also partners on 2 other federal grants that other partners here in the state have around advancing community health workers. We do a lot of work with health literacy across our public health system, both training and providing technical assistance, developing materials for health departments and for their partners. What else do we do? We are involved in the public health infrastructure grant currently with our state health department, as well as the College of Public Health in Nebraska. And so we are at the university hang on just a second, let me pause. I'm going to start over again about that big stuff. We are involved in the CDC Public Health Infrastructure Grant here in our state with the state Office of Public Health at our DHHS, as well as with the University of Nebraska Medical Center's College of Public Health. We're using that funding and that opportunity to advance local health departments' environmental public health capacity in our state, which is not as advanced as in many other states, in part because a lot of those environmental health roles in Nebraska fall to other agencies. We are also using that as part of our involvement in the 21st century learning community and working on public health modernization. So we are our SACHO is one of the leads in public health modernization efforts in our state. We are also doing some pretty exciting partnerships with our Medicaid managed care plans, which is resulting in their investment in the NACCHO as a way to help support community health workers and local health departments